Hello, everyone, and welcome to Neurocracy. Today, we're joined by Dr. Kristen Knutson, Associate Professor of Neurology and Preventive Medicine at Northwestern Feinberg School of Medicine and a leading researcher in circadian rhythms and metabolic health. Her work investigates how irregular sleep timing, especially the mismatch between weekend and weekday schedules, often known as social jet lag, can correlate with cardiometabolic risk, obesity, and insulin regulation. Dr. Knutson, thank you so much for joining me today.
Yeah, thank you for inviting me.
So, my first question for you is, what first sparked your interest in sleep?
Huh. Well, that's kind of a long story, but I'll try to keep it short.
Okay.
So my PhD is in anthropology, so I went to graduate school in anthropology.
Okay.
But before I did that, I was secretary to the chair in the neurobiology and physiology department here at Northwestern. And at the
Okay.
time, that was Fred Turek, who is a sleep and circadian scientist. And so even before graduate school, I learned about sleep and circadian rhythms as my role as a secretary working on grants and class materials for Dr. Turk. And so that really sparked my interest early on. And then as I became an anthropologist, the question was who in anthropology is looking at sleep and human health? And at that time, there really wasn't anybody. And so that's what led me to here today.
Okay. Could you explain a little bit of how anthropology and sleep are kind of connected and maybe how they influence each other in a way?
Yeah, absolutely.
Yeah.
Well, so anthropology is broadly the study of humans and human
Okay.
ancestors, right?
Yeah.
And so, and one of the things we say often in anthropology is there's very few human universals across the world and across all human populations, but sleep is one of them. And then as an anthropologist and human health, I'm interested in not only how biology is influencing health, but how social and cultural factors
Yeah.
influence health and how they work together. And to me, sleep and circadian rhythms is a really ideal phenomenon to look at because sleep and circadian rhythms are influenced by both biology and sociocultural factors.
Yeah. And I know in one of the recent conversations, one of the professors was talking about how Middle Eastern women and their cultural traditions impact their sleep, especially in Ramadan. And I
Exactly.
personally know, like with siestas, and I think there's something called susseguire. I'm not sure if I'm
Mm.
saying that right in Italy, but there's some really cool stuff. So I've always been curious how those kind of relate. But um,
Yeah,
yeah,
I mean, that's a whole other topic for
yeah,
another time, like
yeah, yeah,
cultural differences in sleep
yeah. That's
practices
true.
and patterns
But
and
yeah, yeah. I
who,
just wanted to
where and
bring it
when they
up.
sleep. Yeah, no, I
Yeah,
think it's really
exactly.
interesting.
But so I
Obviously.
guess coming back to the idea of social jet lag, like I mentioned
Mhm.
in our introduction, could you explain a little bit of what social jet lag means for people who might not know, and then why it's relevant in today's world?
Absolutely. So jet lag, most people have heard of jet lag, which is when you travel to another place that's in another time zone. And so your internal biological clock has to adjust to the new external clock time. And there's some discomfort and circadian disruption. So disruption to your internal clock timing associated with traveling across time zones. While social jet lag is the idea that even without traveling, we can sort of induce jet lag or circadian disruption by having irregular sleep timing. And so social jet lag is often looking at the difference between your sleep timing on work days or school days versus free days, because a lot of people shift their sleep timing when they don't have to get up the next day for work or
Yeah,
school. And that can lead to internal circadian disruption. And that's why it's relevant for everybody,
right.
because you don't need to travel to have jet lag in this sense.
Yeah. And I think for me personally, like one of the places that I see the most is with myself and my friends in high school. So what a lot of like teenagers my age do, and a lot of high schoolers, I think, throughout the US, we try to catch up on sleep
Mhm.
on the weekend. So could you talk a little bit of talk a little bit about like maybe why or why not this works or doesn't work? Yeah.
I mean, I think the evidence is not certain right now about whether you can truly catch up um, on sleep or make up for circadian disruption. And part of that, part of it's math. So if you're sleep depriving yourself for 5 days a week,
Yeah.
it'll be mathematically difficult to make up for that with only 2 days a week, right?
Right. Yeah.
Um, and so, but that said, there's some evidence out suggesting that if you aren't sleeping enough, getting a little more sleep on weekends is beneficial. But if you are sleeping enough, having this social jet lag is problematic. So I think
Yeah.
it's this combination, like you were getting at, like, do we sleep more and then risk some social jet lag, or do we stay short sleepers? And I think obviously the ideal is don't be a short sleeper and be regular. But given the choice, I think doing some catch up on sleep, there's some evidence to suggest that might help.
Yeah. And I know one of the things that people like to focus on is total sleep time, But I
Hmm.
do believe some of your research also highlights timing and consistency, which is a very important thing to consider too. So could you talk a little bit about what you have found in terms of the importance of timing and consistency relative to the total time of sleep
Yeah,
duration?
I mean, I think an important message that many of us are saying is that healthy sleep or sleep health is multidimensional.
Right.
It's not just how much sleep you're getting. There's a lot of papers on sleep duration, but more and more we're talking about the importance of other dimensions of sleep health, like quality, and then, as you just brought up, regularity of sleep, timing of sleep,
Yeah.
as well as the absence of sleep disorder. So to come to timing, what we've found is that people who on average go to sleep earlier, eat earlier, tend to be healthier than people who sleep or eat later. And
Yeah.
then similarly, people who are more regular with their timing of sleep and aren't jumping around the clock tend to be healthier than those who are less regular. And
Yeah.
that gets down back to this circadian clock and circadian disruption. And I can talk more about that as you.
Yeah, actually, that would be good if you could talk a little bit about that.
So, our internal clock certainly controls a whole lot of physiological function, our hormone levels, our alertness levels,
Yeah.
our heart function, metabolic function. But but if your clock is, let's just oversimplify it, if your clock is confused about what time it is, or your behaviors are happening at a time your clock is not expecting them to. So if you're sleeping or in the biological daytime or you're
Right.
eating in the biological nighttime, this can cause sort of desynchrony or inappropriate responses to those behaviors. And so you really want your behavior and your internal clocks to be aligned with one another and consistent with one another.
Yeah.
And that's why we talk a lot about timing and
Yeah.
regularity.
So I guess now that you mentioned the idea of like sleeping in the day and how that kind of might affect like synchrony of the clock, this is more of a personal question, but I think it's kind of a real application of that
Hmm.
idea. So with my school start time of 7:30 and
Hmm.
I tend to go to sleep around like 11:30 to 12. So I have a little bit of like sleep deprivation. So what I do like naturally is I try to take a nap after school. So like
Hmm.
sometimes like in during this time, my school ends at 2:30. I would actually be napping.
Oh, I'm
And
keeping you
let's
from sleeping.
no, 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 you're fine.
Uh-oh.
No, but I'm just saying, like in general, like sometimes I like to take a nap after school, and let's say this nap is maybe an hour and a half.
Hmm.
So how does that relate to healthy sleep for me personally? Does that help it, or does that not help it? How does
I
that
think
work?
that's, yeah, I think that's another important question, and we're not 100% sure. So
Okay.
let me preface it by saying that.
Yeah.
But,
Yeah.
there's, and it's a hard thing to test, particularly with chronic diseases. We can't do experimental studies that last for months or years.
Yeah.
And so there have been some shorter term studies that have looked at the effects of naps on some outcomes and have seen beneficial effects, particularly for alertness. Um, Less so that I'm aware of, looking at more cardiovascular and metabolic outcomes. And
Okay.
I think that's an important, and by age group. So
Yeah,
does it
it's
differ
true.
depending on someone your age versus someone my age?
Right.
I think these are really important questions to understand ways and behaviors to mitigate some of the effects of sleep loss because our schedules, our work schedules, our daily schedules are not always under our control. And so figuring out other strategies to sort of deal with, short sleep times at night, is there ways to mitigate the effects of that or irregular sleep times?
Yeah.
The shift work being the, really prime example of
Yeah.
an area that needs help.
So this is more of a specific question that I didn't really figure out before the interview, but I just want to ask you right here. So when you're studying like how sleep irregularities affect the risk for like cardiometabolic risk or obesity,
Hmm.
similar factors, what I guess what like age group or like who is this like who are these like findings like relatable to, I guess. Yeah.
Well, my everybody. I
Okay.
mean, I think everyone needs good sleep and circadian health. Like
Yeah.
everyone, that is a part, should be part of a healthy lifestyle. How strong the effect will be on your outcomes is going to differ not only by age group, but disease condition or other vulnerabilities. And so I think understanding the impact of poor sleep or disturbed circadian rhythms in these different groups is really important. And more importantly, what can we do about it? And how can we help different individuals and different groups improve their sleep and circadian health and and get the most beneficial effect
Yeah.
from that?
So the reason I wanted to ask that is because one of the things that I'm really passionate about is pushing back high school start times. And I'm
Hmm.
working with the state senator right now to try to pass
Oh, excellent.
legislation for Missouri. But I guess one of the really cool things that you've been able to do is like show that risk, right? And how that how sleep irregularities can really connect to risk. for physiological like risk factors. And do you think that this is relevant with teens being sleep deprived these days? Does that correlate with maybe future health outcomes for teenagers? These early school start times and misalignment with the clocks. I guess could you like elaborate a little bit on that kind of
I
idea?
think I think adolescents and teenagers are the most one of the most vulnerable groups
Okay.
in American society in large part because of the disconnect between their internal biology, that's a fact,
Yeah.
their circadian biology, and the
Research.
external social world, like the teachers and bus drivers and everybody wanting school to start earlier. It's just not a good
Yeah.
match. And it sets them up for poor health, poor schooling. Like forget
Yeah.
whatever they're supposed to be learning in the first period,
Yeah.
let alone help us all if they're driving to school.
Oh
So
yeah, I
there's a
know.
lot of risk
Yeah,
factors
yeah, yeah.
right then and there, let
Yeah.
alone, setting, the health behaviors we learn in high school tend to stay with us. And so if we're
Right.
already setting them up to have sleep irregularity and social jet
Yeah.
lag as
It's almost like
normal,
normalized. Yeah,
yes,
exactly.
you and I are coming up with the
Yeah,
same term.
yeah,
That's
yeah.
a problem. And then we have to then we tell them like 5 years, 10 years later, oh no, you're not supposed to do that. Like it's much harder to change
Right.
patterns of behavior once they're set in.
And that's interesting perspective, especially because I think like there's those periods of plasticity, and then like I guess especially like younger adolescents, like it might be like it's easier to like teach people and kind of develop these long-term like ideals, right? So that's
Absolutely.
interesting.
And
Yeah.
yes, they're young, so maybe having
Yeah.
a heart attack isn't of major concern, but
Right.
setting these patterns and behaviors and earlier life exposures is still incredibly important
Yeah.
for them.
And I think one of the unfortunate things is due to the like the social pressures of academia or work, right?
Hmm.
I think that a lot of people turn to almost artificial ways to allow them to sleep less. Like I think namely energy drinks,
Mm,
like
yeah.
and caffeine, I guess. I mean caffeine not as bad as the energy drinks, but still, I mean both do affect like health outcomes, I would say. So,
Yeah, they're just trying to
yeah.
mask the effects of sleep deprivation. They're
Yeah.
not making anything better.
Right.
Yeah.
So I guess my next question is I've actually
Hmm.
never asked this question to anyone on this podcast, and I haven't done much research on it either. So I'm interested to ask
Okay.
you. So how much of the like risks or the damage from social jet lag or sleep deprivation in general, whichever you think you are
Hmm.
better equipped to answer, is reversible if
Hmm.
someone later stabilizes their sleep schedule? So I guess we're kind of going on a tangent here of the idea of let's say you experienced sleep deprivation during high school, but now you have time to recover. Like, is it recoverable or is there, I guess, how does that kind of play out?
Well, without again, these will require some pretty long-term studies
Right.
to
Yeah. Yeah. Yeah.
truly answer with
Yeah.
evidence. But if we look to cigarette smoking as an analogy, where we know
Okay.
that no matter how long you smoked, stopping now is going to have health benefits.
Yeah.
So I think with sleep and circadian disruption is no matter how long you've been a short sleeper or have had circadian disruption, if you can sleep more, reduce the circadian disruption, or have some other way to mitigate the effects, it's going to have health benefits, in my
Yeah.
opinion. Saying that with no evidence, but
Yeah.
that is what I truly believe is that anyone, regardless of how old they are or their circumstances, could benefit from strategies to help them improve their sleep and circadian health.
Yeah. So, my next question is kind of more for practical implications of these
Hmm.
findings, especially for teenagers like me who might
Hmm.
have difficulty changing the systematic policies in place,
Yeah.
despite my trying.
Yeah.
But Um, let's say like, we experience social jet lag. We try to catch up for sleep on the weekend. What are some practical strategies that we can implement to try to maintain our sleep hygiene as much as we can based on the factors that we can control?
Right. I mean, that's a good question. And you are,
Yeah.
like we already talked about, in facing some challenges beyond your
Right.
control.
Yeah.
Um, so, I mean, there's certainly some sleep hygiene techniques that can be used to make the most out of the time you have to sleep. So make your room as dark and quiet, as
Yeah.
comfortable and
Yeah.
cool, not too hot, not too cold.
Yeah.
Um, and then during the daytime, to expose yourself to bright light during
Yeah.
daytime hours to really
For
increase your
sure.
alertness and help, and train your circadian clock. And then as much as you can, have regular sleep. Go to bed as early as you can. Don't go to bed if you know you're not going to fall asleep because that's not helpful.
Yeah.
But, don't stay up. scrolling on your phone beyond when you could have fallen asleep. So it does require some willpower to try to maintain and as long of a sleep period as possible. Similar to, if you think about trying to maintain a healthy diet or healthy exercise, healthy sleep requires the same dedication and commitment to trying to maintain those hours and controlling the environment as much as you can whenever you can sleep.
Yeah. Okay. So my next question is a little more fun, and a lot of people
Okay.
tend to be very creative with how they answer this. So if you could change one thing about Northwestern's campus
Oh
to
gosh.
allow people to better align with their sleep schedules or circadian rhythms, what would it be? And this can be a policy, this can be like a physical,
Hmm.
like some sort of like light thing. It can be literally anything. I know people tend to be very creative with these answers, so.
Wow, that's
And I know I didn't send this question to you, so
I know you're
yeah,
really catching me off guard.
yeah,
No, it's fine.
yeah.
So I think we should consider when the first class period is.
Okay, yeah,
I mean, we just talked about making young teenagers,
right.
even by the time you get to college, it's not like you're suddenly a morning
Yeah, yeah. I
person.
don't think it's just like a switch.
I know, if only, right?
Yeah, yeah,
If only we're that simple. And I think I'm not saying eliminate the first period because I
right,
honestly don't even know when it is because there are some people who are morning
right.
people,
Yeah,
but
yeah, yeah,
like thinking about increasing the options at more regular times. Now, I do know Northwestern has access to some light boxes, I believe, and
Oh,
and
really?
sleep
Oh,
tracking.
that's
So,
sweet. Yeah,
we
I
got
didn't know
some
that.
sleep people here. So, I
That's
think there's
good. Yeah,
already a lot on campus
that's
trying to
great.
help.
That's good to hear.
And I think the gym has a light box, although I want to make sure that people are using the light boxes at the times they should be. Like it's not
Oh,
light
yeah,
anytime's good, right?
yeah, yeah.
It's specific times.
And I
So,
know there's a lot of people who study like when light intervention is the best.
yeah.
So yeah, yeah,
Yes. And it depends on you. So it's not going to
yeah,
be
yeah,
8 a.m. for everybody.
yeah,
So I think those things, just thinking about timing and scheduling relative to your population, which
yeah,
here, young college students versus, the 50-year-old professors like myself. So,
yeah.
we might have to accommodate their schedules to make sure they get the most out of the class
Yeah.
and
So
get the most sleep possible.
yeah, yeah, that's true. That's true. So the last question is kind of just about the future. What are
Hmm.
you most excited about in the future of sleep and circadian research in the next maybe 5 to 10 years? Just yeah.
Yeah. I mean, I think I alluded to it a little bit is, we have a lot of data and evidence out there about all the negative consequences of not
Right.
getting enough sleep or circadian disruption or social jet lag. And I really think we need to understand how do we fix that? What can we do to help people sleep better, have better
Yeah.
circadian health? That's feasible too. Like we can't
Yeah,
just
yeah.
go tell people, hey, sleep more, have a regular
Yeah, I
clock and
know.
call it
That
a day,
doesn't
right?
yeah, yeah,
So what's going to work for people? And
right.
I talk often about competing priorities. I know we have 24 hours in a day. We have to do our jobs. We have to take care of
Yeah.
our kids. There's housework. So I'm not unrealistic in thinking people are just going to find the 8 hours and be consistent. So what can we do to support sleep and circadian health that's feasible, that's affordable, and that's effective? And I think that's where we need to really think about the next research is and I know people are doing this, but like
Yeah,
that's
yeah.
what's exciting to me is like how
Yeah.
do we help people
Yeah.
sleep better?
Yeah, I'm excited to see what technologies or interventions come up in the next couple of years. I know I've been talking to a lot of people on this podcast who do very cool stuff. So it'll be exciting
Yeah,
to see.
technology is one of, as that's
Yeah.
been developing is something we could leverage to
Yeah.
really
Yeah. Yeah.
help people understand their sleep and circadian patterns and figure out ways to
Yeah.
work with that.
And okay, so actually this is a Northwestern specific question.
Uh-oh.
I do know there's something called like the time signature or
Mhm.
I might
Yep.
yeah, yeah. Could you elaborate a little bit on that? Maybe like what direction that's going in? Do you like
Yeah,
know?
so time
Yeah.
signature, for those who don't know, is trying to use a blood sample or two to measure somebody's internal circadian clock. Because right now the methods to measure someone's internal clock timing are difficult to
Yeah.
do at scale and for an individual. And so this is one method trying to do that with fewer blood samples. Now, time signature requires two samples about 12 hours apart. There are other groups trying to do it on a single blood sample because it would be nice if we have
Yeah.
an easier way to say, this person's internal clock timing is this,
Yeah.
and this person's is earlier, so that we can really understand these differences internally and time therapy or
Yeah. Yeah.
medicine or
That would
every
be super
diet,
cool. Yeah.
everything to someone's internal clock. But right
Yeah.
now, it's really hard to say, oh, well, your internal clock timing is early or late because it requires some detailed measurements. And so that's what time signature and similar blood tests are trying to do. It's
Yeah.
still work in progress as far as I
Yeah, yeah.
understand. We don't have that nice simple blood test
But
yet.
yeah.
But once we do, I think that could really
Yeah,
open
yeah,
up a
it's always
lot.
exciting. I know when I first heard about it, I thought, wait, that's so cool. Just like
Mm,
almost taking like a screenshot of where your body is compared to like, someone else. Like it's an absolute
exactly.
measure, right? So
Yeah.
that's super cool. But yeah, I mean, thank you so much for joining me
Yeah.
today.
Thank
It
you
was
for having
great
me. It
to
was
hear
fun.
your perspectives and your insights and thank you.
Yeah. Thank you. Sleep well.